Good afternoon, everyone. Thank you for these opportunities to the conference organizer who have been well communicated, coordinated, and managed to get the sections on this panel today for the conference. This section focuses on key issues related to COVID-19 health care system resilience from Thailand. My name is Sukontha Kongsins. I'm an associate professor in health economics, and I also have been in charge at the Research Center for Health Economics and Evaluations under Department of Public Health Administrations, Faculty of Public Health, Mahidol University. Here is the outline of my presentations. First, the structure of health system in Thailand. Thailand has health care system that is one of the world best. We started the Universal Coverage Program in 2002, which opened up universal health coverage to all citizens. Most Thai received health coverage to the Universal Coverage Scheme. This is the map of Thailand. If you see the number 8, the bottom of the slide, the southern part of Thailand, which is connected to Malaysian border. Populations of Thailand is about 70 million. The life expectancy at birth is 77 years old, and the GDP of the country in 2018 was $7,274 per capita. Thailand is a middle-income country with export-led economy which past developed successes based on globalization through trade and foreign direct investment. Thailand is now completed a society. The population age structure pyramid are changing shape due to the decrease of total mortality rate and increased life expectancy. Refer to the structure of healthcare system in Thailand. Public sector health facility play a major role in the Thai health service system nationwide, particularly in the remote area. Private sectors health facilities usually provide services in only urban areas. The Ministry of Public Health, green color in this slide, all majorities of health facility in Thailand. Health facilities of MOPS comprise of national level as about 40 specialized hospital beds. No, about 70 specialized hospital or unit with more 11,000 beds. At the provincial level, there are tertiary care hospitals like general or regional hospital in every province. District hospital in every district and health center, so-called now health promoting hospital in every sub-district or tambon. The private hospital in the red color here provide around 20% of hospital beds in the country. The MOPS has recognized village health volunteer, about 1.1 million. The village health volunteers are part of health workforce which play a significant role in the health system in Thailand. They work closely with healthcare personnel, not only supporting personal health, but also public health, such as mosquito and emerging disease. District health system consists of the district's health system consisting health center for a catchment populations of 2,000 to 5,000 and the district hospital at 30 to 80,000 catchment population. District health system is functioning due to mandatory rural services by all graduates, medical nurses, dentists, and pharmacists introduced since 1972. We have had a policy to recruit rural students for health professional education and hometown placement. These show very effective rural retentionists. Regarding healthcare system and COVID-19 in Thailand.
Thailand has experienced several outbreaks of very large scale, starting from SARS back in 2003. Those taught us lessons, make us prepare for the big pandemic. We started our implementation of WHO IHR capacity in 2006-2007 and also improve our public health emergency management. In early March, we start to see a rapid increasing of local transmission. The number of new cases gradually reduced through April and May.
I will share the lesson learned from each wave. First, to the fifth wave. Thailand COVID-19 situations. You can see from this slide. We have first wave. The first wave was elimination period. Second wave was suppression period. And the third and the fourth were mitigations and shortage period. And the fifth wave was Omicron variants of concerns. First wave. The first wave we concern like leadership and governance for the first wave. This slide shows Thailand COVID-19 management on our ground. The Center for COVID-19 Situation Administration, or in the blanket CCSA, was set up on the 12th of March 2020, chaired by the Thai Prime Minister. So the Thai Prime Minister is act as the incident commander at the national level, followed by ministry level and department level. Health is the first priority, or health is the first priorities. In terms of leadership, service delivery, informations, financings, medical products and technologies, health workforce. Under leaderships I mentioned earlier, so we set up CCSA, national lockdown, closing border, even for the Thai. Under service delivery, as I mentioned earlier, we have full coverage of primary health care, including 1 million of village health volunteers. We also established RT-PCR lab by June and the nationwide by October 2020. When we found the test positive, so we treat them at the test facilities. Refer to the financing. The purple one, financings. Free for all. I mean free of charge for all. For the test, treat, isolate, and quarantine. The financings allocate to public and private sector using universal coverage for emergency patients. We also reimbursement the system to the National Health Security Office. The Thai government spent around 45 billion baht special budget for COVID-19 response. Under the health workforce, you can see from the slide, there are physician, nurses, and over 1,000 SRRT, stand for Surveillance and Rapid Response Team, as well as the healthcare personnel, especially those who were trained under the field epidemiology training program, were the key persons for the field epidemiology activities in Thailand. Refer to the medical product. You can see from this slide, it's related to risk screening, contact tracing, and quarantine. I move to the second wave, which is all about suppression period. Then we talk about health system response and localized social measure as well. First, I will start with change in governments and leaderships. In October 2020, we have new MOPS, permanent secretaries. Under second wave, more relaxing policy, like from elimination to suppression. Economy recovery, such as organization quarantine for migrants and some relaxing measures. Tourism reopenings, particular special tourist visa for shortened quarantine. Another issue related to the health system response. The red color refers to highly restricted zone. The dark red here, refer to maximum and restrict control area. The orange one refer to the restrict zone, and the yellow refer to control zone. Follow from the first wave in terms of service delivery. We estimate up to 7,500 beds field hospital. In terms of healthcare workforce, we need to mobilize healthcare workers for field hospital, as well as doing some active case finding. Regarding the financial or financings, we reimbursement for undocumented migrant testing. Next is on about suppression strategy to protect both economies and health, or localized social measure. This map shows you the provincial zonings and restriction level announced in early 2001, as mentioned in my previous slide. Provinces were classified and zoned from red to yellow. Therefore, localized social measures were performed to protect both economic and health from zoning. To compare to the previous slide, such as you can see from here, ban of working at office, domestic travel restrictions in each level, process of the market, restaurant, nightclub, fitness, gym, and spa in each color here on the left-hand side. Then we move to third and the fourth wave. The third and the fourth wave mention about mitigations and chaotic period. At that period of time, we have alpha variant of concern and delta variant of concerns. In the Thai health system context, I could emphasize a couple of things, such as universal health coverage policy with full population coverage under our public health insurance scheme. 100% geographical coverage of health services at sub-district, district, and provinces. We also establish referral system. And as I mentioned, 1 million village health volunteers working in the communities. Almost all the health facilities are under MOPH. In this slide is the summary of primary, secondary, and tertiary prevention on Thailand response to COVID-19 pandemic. So as a public health measure regarding prevent, detect, treatment, and control, so far we should focus on primary preventions. So here are all primary preventions. State of the healthcare system for COVID-19 situation in Thailand. Again, village health volunteers are really the eyes and ears of the health system in the communities. We have collaborations with public and private partners. Regarding the Thai context, whenever we have crisis, the Thai will help each other or donate for each other. We also have greeting cultures. Now, move to the fifth wave. So we have the problem of Omicron variants of concern. Our regional health inspectors, very famous one, Dr. Thanarak Palipat, he's mentioned that failing to prepare is preparing to fail. He give more example at all administration level, such as country, regional, province, district, sub-district, that link to the lead organizations that I mentioned earlier. There are responsible bodies and very important, the key health personnel or key responsible person in each level. To prepare for better response. Early detection of import case and prevent the spread of disease in the countries. Second, minimize the case fatalities, proportion, and health impact from COVID-19. Then, mitigation socio-economic impact from COVID-19. In the green color in this slide, show the traditional public health that we have to prepare better. For example, find patients, isolate, and care of them. Find their context. Educate people and strictly follow infection control in the hospital. Here is the continuous capacity expansions from the port to entry quarantine. From the test to the communities, to the hospital, and to the hospital. The hospital will handle service cases. Conclusions. Strong, well-resourced, and inclusive medical public health system is very important. Administrative system that adapt to changing demand, consists of and transparent communication leading to compliance of the public with protective measures. Next, a whole of the society approach, including engagement with academia and the private sectors. Nobody is safe unless everybody is safe. We need also to do vaccination campaign. We are strong, but not because we are rich, but because we fight and we do not give up. Thank you very much for your attention.